Hi guys, today's video will be on medications for acid reflux and GERD, also known as gastroesophageal reflux disease. Before I begin, I want to stress that medications are only used for acid reflux and GERD if changes in lifestyle, such as avoiding food triggers and not laying down for 3 hours after eating, are not working. If you haven't watched my previous video on how to help improve acid reflux and GERD symptoms without medications, I will leave a link in the description below. Alright, so there are several medications used for acid reflux and GERD, but we'll start with the weaker ones like Antacids and Gaviscon, and then move on to the stronger ones like H2 blockers and the notorious Proton Pump Inhibitors. If you're only interested in certain medications, then go ahead and skip to that section of this video. Regarding antacids, as the name implies, they counteract stomach acid to help with acid reflux symptoms. Some examples of antacids are Tums, Rolaids, Mylanta, Maalox, milk of magnesia, Pepto-Bismol, and Alka-Seltzer. Antacids do not prevent acid reflux, they're just used as needed to help with the symptoms. They work fast but don't last long. Antacids are available over the counter without a prescription, but I do want to mention some things to watch out for. First, antacids with calcium or aluminum can contribute to constipation, while antacids containing magnesium can have a laxative side effect and contribute to diarrhea. Second, people with kidney disease should watch out for any antacids that contain magnesium and or aluminum, since they can build up in the body if the kidneys are not functioning properly and cause issues. Next, Alka-Seltzer contains aspirin, which is important to note for people on blood thinners or at a high risk for bleeding. This bleeding risk is important to note with Pepto-Bismol as well, since the main ingredient in Pepto-Bismol is related to aspirin. While we are talking about Pepto-Bismol, I think it's important to know that Pepto-Bismol can make your tongue and poop turn black, as well as cause a hairy-looking tongue. If this happens, it's usually temporary, so don't freak out too much. Next tip is that antacids interact with a ton of medications, so make sure to talk to your pharmacist regarding how they might interact with your medications and how to space them properly. Regarding pregnancy, certain antacids like Tums, Rolaids, Mylanta, and Maalox are generally the medication of choice if lifestyle changes to help acid reflux don't work, but make sure to talk to your doctor and pharmacist regarding proper dosing. Next class of acid reflux medications are surface agents like Gaviscon. While Gaviscon is technically also an antacid since it contains aluminum hydroxide and magnesium carbonate, it also has an ingredient called sodium alginate or alginic acid that coats the top of the stomach. The sodium alginate acts as a barrier so acid doesn't go up and burn the esophagus and throat. Gaviscon is relatively weak in the big scheme of things, but might be slightly stronger than other antacids due to its sodium alginate ingredient. There's also another surface agent medication called sucralfate that is often used in treating ulcers or for acid reflux and pregnancy, but it's prescription only and we won't get into it today. Next up are H2 blockers. H2 blockers like Pepcid and Tagamet reduce acid production in the stomach by partially blocking acid pumps in the stomach. I would consider H2 blockers as medium strength. They're stronger than antacids, but not as strong as proton pump inhibitors like Prilosec. H2 blockers take longer to start working compared to antacids, roughly 2.5 hours or so, but also last longer, about 4 to 10 hours or so. That being said, they tend to lose some effectiveness after about 2 to 6 weeks of use. Regarding side effects, H2 blockers are generally well tolerated and side effects tend to be rare. Regarding drug-drug interactions, Tagamet, also known as cimetidine, is a little notorious for interacting with lots of medication, so don't hesitate to ask your pharmacist about this if you're starting to take Tagamet. While we're on the topic of H2 blockers, I can't not talk about the whole Zantac Recall debacle. Basically, the FDA found that many samples of Zantac, also known as ranitidine, that they tested had unacceptable levels of a potentially cancer-causing impurity called NDMA. They found that the levels of NDMA in ranitidine increased over time under normal storage conditions and significantly increased when stored at warmer temperatures. Because they couldn't guarantee that the NDMA levels in ranitidine would not increase to an unacceptable level, ranitidine was taken off the market. Pepcid, Tagamet, and other acid reflux medications were tested and found to be fine. You might see Zantac back on the shelves, now called Zantac 360, but it's actually just famotidine, which is the main ingredient in Pepcid. Alright, so moving on to the notorious proton pump inhibitors, also known as PPIs. PPIs reduce stomach acid production by blocking acid pumps in the stomach. They're stronger than H2 blockers because they block these acid pumps more completely than H2 blockers do. Some examples of PPIs are Prilosec, Nexium, Pepcid, GERD, Acid Protonix, and Dexilent. Some are available over the counter, while some are prescription only. PPIs would be considered the big guns and are at the top of the totem pole as far as potency. Most PPIs are taken 30 to 60 minutes before breakfast and are generally not used on an as-needed basis because they can sometimes take a few days of consistent use to start working properly. That being said, don't use them longer than 2 weeks without doctor's approval due to two reasons. The first reason is that you want to make sure that there's not something more serious going on with your stomach that needs a doctor's attention, that you're just masking with the medication. And the second reason is due to the potential for long-term side effects with PPIs, which is why they're generally used at the lowest dose necessary for the shortest period of time necessary. When used for a long time, PPIs are known to affect the absorption of magnesium, vitamin B12, iron, and calcium, and potentially contribute to deficiencies. Many doctors will check labs periodically in patients on long-term PPI therapy to screen for these deficiencies. As a quick side note regarding the calcium absorption issue specifically, I just wanted to mention that calcium citrate is usually the preferred form of calcium supplement in people on PPIs that are also taking a calcium supplement for one reason or another, since calcium citrate doesn't need the acidity in the stomach to be absorbed properly. Long-term use of PPIs is also linked to many things like C. diff infections, increased risk of fractures, potential for worsening kidney disease, dementia, and pneumonia, among other things. Many of these are debatable, and remember that association does not mean causation, but again, this is why you generally want to use the lowest dose necessary for the shortest period of time necessary. There are some scenarios when the benefits of long-term PPI use do outweigh the risks, but these are usually with more severe conditions like Barrett's esophagus and erosive esophagitis. Regarding drug-drug interactions, proton pump inhibitors can also have some serious interactions with medications, but hopefully your doctor and pharmacist will monitor for these. So that's it for today. If you learned something or found value from this video, make sure to hit that like button. If you want more easy to understand content on health and medicine, make sure to subscribe to the channel. And last thing, this video is for educational use only. This video is accurate to the best of my knowledge as of the date posted, but data is constantly changing, so always consult your doctor and pharmacist regarding your medications and what would be best to do in your specific situation. Thank you for your time and stay healthy. See you next time.